Welcome. My name is Dr. Amod. I'm a consultant in pain medicine. The presentation today is coming to you via Education Without Barriers, which is involved in enhancing educational and training opportunities for pain physicians all over the world. So, the topic for today's presentation is CM image optimization and radiation safety. I selected this topic because last month was September, which is the Pain Awareness Month. And I know a lot of pain physicians have worked hard to create awareness about various pain conditions and their management options. So I thought, what better to follow in the month of October than to discuss something which is relevant not only for our patients, but also for our personal protection, as in like the pain physicians and their protection. This is something which is not very well covered in various training programs and is often ignored by pain physicians. So I thought it's important to talk about this. Now, before we move on to the presentation, this is also linked to two other programs which I need to mention briefly. One is Distant Mentorship Program, which I've started recently, and the other one is STEP. STEP stands for Simplifying Training and Education in the Field of Pain Medicine. This is something which has just been started. Again, if you're interested in any of these programs, you can find further details about these on my Facebook page, which is Education Without Barriers. So what you need to do is search for me first, Dr. Amod Manocha, and then you'll see my page, Education Without Barriers, which is linked to this, and you can find further details there. So without further ado, let's move on to the presentation, and I hope you find it useful. So the faculty for the presentation today is going to be me, Dr. Amod Manocha, and in the subsequent presentations over the period of time, you'll see Dr. Puneet come and help us from time to time. So as we discussed before, the presentation today is on CM controls or image optimization and radiation exposure. What you see on your screen is an image of a fixed fluoroscopy machine, which is commonly used in most hospitals you would go to, and I'm sure you've all seen that before. Now compare this with a CM, which gets its name from the C shape. The CM offers advantages in terms of mobility and portability, and the ease of taking X-rays from different angles. So this image over there displays a GE machine, which is what I have in my hospital. So I thought this would be an easier one to explain things with. And it's quite a commonly used machine. So the different components of a CM include an X-ray tube, which is where the X-ray beams are generated from. It's housed in a lead box, and the X-ray generator in there converts the AC current to a high voltage DC current. So the X-ray beams produced in there travel from there towards the image intensifier, which is located at the opposite end of the C. So this over there is the image intensifier and where the images are being generated. Other important components are the workstation or the control panel, which houses a lot of switches. We'll talk about these in details a little bit later. Then you've got the image display system, which normally has two screens and a keyboard, and often is attached to a printer or other devices used for storing images. Then apart from this, there may be a foot pedal down over there, which is often used for screening, taking images, if the control is with the person who's conducting the procedure. Then there are lots of other cables and wires. There are control switches, which you can see over there and over there. There's another control switch in the just behind the control panel. So all these are different components of the CM machine. Okay. When we talk about the workstation, there are three figures which are displayed, which we can change. One of them is the current, which is displayed in milliamperes. The other one is the voltage, which is displayed in kVp. And then in the middle, you have the fluoro time. So this is how station or the workstation looks like. We'll talk about the different switches in a little bit. So when we alter the current, whether we increase or decrease the current, what happens is the intensity of the X-ray beam being produced by the X-ray generator changes. So the more the current, more the intensity or the density of the beam. So this would mean that more of the X-rays would be reaching the image intensifier. And what this alters is the degree of blackness of the image, or the quantity or the intensity of the X-ray beam. So that's how current is used. Voltage basically does not alter the intensity of the beam, but it alters the energy of the X-rays being produced, or their wavelength being produced, and that in turn influences the penetrating ability of the X-ray beam. So you can look at this as the contrast button. So when you change the voltage, what you're changing is the contrast, or the number of shades of gray you see, or the quality of the image. Another thing we can control is the exposure time, which is the length of time for which the X-ray beams are being generated. More the exposure time, more the X-ray beams reaching the image intensifier. So all these three factors can influence the radiation exposure, hence we are talking about it. Generally, the C-arms allow for a fair amount of movement. They don't go 360 degrees, but they would easily rotate from something like 225 degrees, enabling you to see the same structure from different views. Okay, now let's move to the next section, which is looking at the C-arm controls. So as you can see, the button seems to be housed into different compartments, and this is to group together buttons which perform similar function. So let's look at the left top corner, which I'm highlighting now. There are buttons which are grouped together, and these buttons are mainly to do with the rotation and the orientation of the image as you see it on the screen. So the top two buttons, which are these ones, rotate the image in either direction by a small fraction, say about 1 degrees. And the lower two buttons, which are these two, are to do with the mirroring of the image or reversing the image. So this is how you see the image on your screen. If you move below that, the section below with the three buttons, the first button is for saving the images, and it clearly mentions that below the image. The second blue button down over there is for swapping the image. So if you want to see the last image on the other screen, you can swap the image from one screen to another. The third button over there is mode button. So this button is to switch directly into the subtraction mode. Now let's move to the next section, which is this one. So this is the section which is got the magnification button. So that defaults to mode, which is normal magnification, and then if you can see below that, there are two more options, which are mag 1 and mag 2. So when you press this button again and again, it changes from mag 1 and then to mag 2. So you might need to magnify images if you're looking at smaller anatomy, or if you are doing fine stuff like passing in guide wires and you want to see them clearly. So that's when we use this button. Moving on to the next section, which is this one. This is to do all with collimation. So there are two types of collimation. Collimation basically means reducing the area which you are seeing, and this can be quite handy. I use it regularly to reduce the radiation exposure and make my images better. And this can be quite handy when, let's say, you're seeing the sacrum in a lateral image, and because of the density of the hip joint below and a different density of the air above the sacroiliac joint, the image quality is quite variable, and often you struggle to see the images. So that is one situation where I use the collimation very regularly. So you've got two types of collimators. One is the iris collimator, which is the buttons over here. These circle on to the center of the image. And the other one is the shutter collimator or the leaf collimator, which are these two buttons. So this is like shutters coming in from the side, from both sides, and kind of narrowing down the area of vision. And with the shutter collimators, you can rotate them using these two buttons to kind of get the orientation you want to confine with the anatomy. So these are quite useful to increase the image quality and to reduce the radiation exposure. The next section we have got is over here. The machine always defaults to this mode, which is the auto contrast mode. And if you press this button again, you can adjust the contrast and the brightness by using these two arrows or these two buttons. The next section is to do all with the controls of the KV and the MA. If you see this button is lit up, this is the auto setting, which is also the auto KV or the auto KV and auto MA button. So the machine defaults to a certain setting when you on its own, and this button is always lit up when you switch on the machine. However, if you want to change the preferences, you can manually change by by using these MA and KV buttons. Um, in the lower end of the machine, or in the lower end of the same box, you've got three more buttons. First one says pulse, so this is like giving pulsed, using pulsed beam, and this reduces the radiation exposure significantly. The other corner, this button is low dose. Again, this is something which we use quite often to reduce the radiation the patient's being exposed to. And when you use this button, this automatically drops the MA over there to half or even more than that. In the center over there is the high level fluoro button, HLF. This kind of is used when you want very fine images or good quality images. Generally, people use this when they are kind of taking a final shot for storing images. Now, just one last section left, which is this top one. This is to do with the alarm. So let's say the alarm's set at 5 minutes of radiation exposure. So when you have done 5 minutes of radiation exposure over there, this alarm would kind of sound to warn you about the amount of radiation exposure, or the time for the radiation exposure. I've found that the knowledge about the CM controls has come handy on a number of occasions for me. Like when I get new radiographers who are not my regular radiographers and they are struggling to get me a good image, just a few suggestions or a few tap of buttons to help them have helped me do the procedure better and minimize the radiation exposure for everyone. Now, moving on, depending on the type of machine you have, your machine may or may not have some extra features which can help you perform the procedure or get a better image. So you can have 3D navigation aids, you can have advanced imaging processing softwares which can make your image really, really clear. You can have laser aiming guides. I find these really useful if you are kind of trying to identify the point for needle insertion, and they can guide you a lot with this. Digital subtraction angiography, that's really useful when you want to avoid intravascular injections such as cervical nerve root blocks. So when you want to be absolutely sure that it's not intravascular, this is something which can help you more than other modalities. So taking a step back and talking about ionizing radiations, two main types to talk about: X-rays and gamma rays. Gamma rays are the ones which we get from the radioactive materials, and X-rays are the ones which we use in our normal fluoroscopy. Whenever we are using X-rays, the basic principle to guide the usage is LRA, which stands for as low as reasonably achievable. In simple language, it means keeping the radiation exposure to minimum as much as possible. Now, whenever a person is exposed to radiation, we talk about measuring that exposure, and this can be done by using units called RADs, which stand for radiation absorbed dose. So when matter is exposed to radiation, there is some absorption which takes place, and this varies with the matter involved. The other unit which is used along with rads is grays. So 1 gray is equal to 100 rads. Now, there are different kinds of radiations, as we talked about before: X-rays, alpha rays, gamma rays, and the biological effect of these can be varied. So to kind of equate them or get them on a normal scale, we use a quality factor to accommodate for the type of radiation. So when we are measuring the exposure, the unit used is called REM or civets. REM stands for radiation equivalent men. So the upper limit of exposure, universally kind of defined or agreed on, is 5 rems per year, which is equivalent to 50 millisieverts per year. Now, it's important to understand that the exposure for different parts of the body for harmful effects can be different. Like the lens might have a different threshold to get affected compared to the extremities, compared to the organs of the body. So the limits would be varied depending upon what structure we are talking about. If you want to talk about, if we are talking about lifetime exposure for a professional, it's approximately 1 rem multiplied by the age of the worker. So if I'm 40 years old, my lifetime or my exposure till that time should be about 40 rems, not more than that. So when we talk about minimizing the radiation exposure, there are a few things which we can do. Number one is reducing the exposure. Now, it's when we talk about the exposure, it's important to understand the radiation does not just limit itself to the area which is visible on the X-ray image. It is not conical, it's in fact spherical. So it spreads much beyond the area which you can see on the X-ray image. Then the other thing we can do is increase the distance. The further away we are, the lesser the exposure, and this is related, and this is inversely proportional. So the further you are, the exposure is reduced by the square of the distance, right? So if you can, general rule is, if you can extend your arm and touch the C-arm, that means you're too close to it and you need to be further away. Now, the other thing which we do, I'm sure all of us do that, to protect ourselves from the effect of radiation, is shielding. We're going to talk about each of these a little bit more in detail. So, basic things when we talk about minimizing radiation exposure: make sure equipment is in good working order. Obviously, having the latest equipment helps to minimize the radiation exposure, but that may or may not be achievable depending on the setup you're working in. Even things like the material of the table or the padding which is used on the table makes a lot of difference, because if the material is quite dense or uneven, it can either kind of compromise your image or produce artifacts. So the newer tables which are coming are kind of carbon tables, and taking images through these requires less amount of radiation. Things like foam pads, if they are or gel pads, if they are irregular, then again this kind of affects the image quality and the amount of radiation exposure. Sometimes we use what is called a diving board configuration. Like if you're doing a cervical spine procedure, it's not uncommon to see having a wooden board which is extending beyond the edge of the table on which the patient is lying. Just the head end of the patient is lying on it. So this kind of, because the wooden board has got, it's thinner and it's got, the consistency is different. So the X-ray beams don't have to travel through the thick table, and this kind of minimizes your radiation exposure as well. And then the obvious thing would be to minimize the radiation exposure, have less people in the room. So whomsoever is not required should not be in the room. Now, moving on to the shielding, lead aprons are something we all use. You must have seen different varieties on it. You get the jackets and the skirts separately, or you get the one-piece ones. I prefer the separate ones, which is the jacket and the skirt separately. There are few advantages which come to my mind when I say that. Number one, the whole weight of the lead apron is not hanging on my shoulders and not straining my lower back if I'm using the two-piece ones, because it's divided. Half of the weight is on my waist and half of the weight is on my shoulders. So it kind of, from the mechanical point of view, it is less load on my back. The other thing which I find useful is when we're using the skirt ones, even if they are thinner ones, say 0.25 millimeters, because they overlap each other, as in like when you're kind of wearing the skirt, there is a bit of overlapping, so it offers extra protection. So 0.25 plus 0.25 becomes more than just 0.25 apron, and that gives extra protection to your genital areas. Lead aprons, they come in different thickness. The thicker, the more protection, but obviously it becomes heavier and bulkier and restricting your movement. They should not be folded and regularly checked for any breakages or cracks, because this can compromise your safety and increase your radiation exposure. Then the other accessory equipment which we use regularly, at least I use regularly, is thyroid shields, eye protection with lateral shields. This is something which I think is ignored quite often, the eye protection, especially the ones with the lateral shields, because less people realize that it does increase the chances of them getting cataract at an early age. So if you're doing procedures regularly, this is something you should not ignore. Leaded gloves, I hardly ever use that, because I try and keep my hands away from the image area, and I try and step back as much as I can when the image is being taken. Also, even if you are using these, the image quality changes because of this leaded glove being in your picture. So I don't kind of use them very often. Mobile barriers are some things which are used in specific scenarios where there's lots of continuous exposure, such as an angio suite, or where regular radiology procedure is being done where the exposure is too much. So there's this mobile barrier, and you can go and stand behind it and shield yourself more from the radiations from the radiation in the room. So there are things which you can do to minimize the radiation exposure. So simple things like last hold. So if you have two screens, you have the last image on one screen. That helps you locate where you were in the previous image, and if you modify anything, then you have got a better correlation in terms of how things are moving. Then simple buttons on the CM control panel, which we've discussed before, like the pulse mode, can reduce your exposure by 50 to 75% easily. Then using low dose setting, these are two buttons which we have seen before. So this is the pulse mode one over there, and this is the low dose one over there. So using these two buttons helps to minimize the radiation exposure. Most C-arms would automatically adjust to keep the kV relatively high and the MAs relatively low. The other things which you can do, which I really ask for very often, is collimation. So collimation is of two types. One is iris or circumferential, where the image is narrowed down in a circular fashion around the center. And the other one is shutter, linear, or leaf, where you get shutters or linear collimators coming from the sides, and you can rotate them to adjust it to the anatomy. We have discussed this before when we were talking about the buttons on the control panel. So use this very often. It not only gives you better image, but also can help you minimize the radiation exposure. So in between the two buttons where you see that film written, this is actually a button which I try and avoid using too much, because this is the high level fluoroscopy, which gives you a better image, but then it kind of increases the radiation exposure. If I have to use it, I would use it only when saving images. Other things you can avoid is like continuous screening, because obviously the radiation exposure is more. Magnification increases the radiation exposure, and some machines are actually equipped with a zoom feature. So which is like a digital zoom you can think of. So if you had to do this and it doesn't compromise the quality of the image, then this is a better option to use rather than the Mag 1 and the Mag 2. Going back to things you can do in terms of the technique you are using to minimize the radiation exposure, simple things like don't try and image beyond the body surface area, because when there is air or the table coming into view, the radiation exposure required changes, and often you need multiple views with more intensity to get a better image. Then simple things in your technique, like keeping the X-ray tube or the X-ray generator below the table, reduces the exposure for the patient and the other staff. And then keeping the top end or the image intensifier closer to the patient also helps reduce the exposure. Now, sometimes this becomes a problem because our needle, because our hand can kind of end up touching the image intensifier. So I normally try and keep it as low as possible, but not compromising the sterility of the procedure. So when you're kind of planning the procedure, if you have a choice, like when you're taking a lateral image, if you have a choice on which side of the table you stand, then it's always better to stand on the side of the image intensifier rather than the X-ray tube. So it's always better to be away from the side where the X-ray beams are being generated from. Other simple things you can do to minimize your exposure, things like injecting contrast through an extension tubing, because then you have the option of being further away, and often when you're injecting through extension tubing, you're taking a continuous screen as well. So that is the time when you really want to be away from the machine as much as possible. So a simple extension tube can help you with this. Now, just moving on to the last bit, the damage which is caused by the radiation is via the generation of free radicals, which can damage the cell membranes, and also via mutation. To measure this exposure, we use badges, and I'm often asked where is the best place to wear the badge. Is it under the lead cover or outside the lead cover or lead apron? So ideally, having one badge inside and one outside is the best option, because the one outside would measure the external exposure and the one inside would measure the organ exposure. Besides these, you've also got the extremity or hand exposure rings, which I've not seen them being used very often, but yes, they are available. These badges are monitored monthly or every 2 months, depending on the organization and the rules they have. And your hospital should be keeping a track of your radiation exposure. That's all I've got to say for the presentation today. I hope it's given you some useful tips in terms of modifying your practice and doing simple things which can reduce not only the radiation exposure for your patients, but also for yourself and your other colleagues. Thank you very much for listening.